Aggregate summary data always are challenging for the media to interpret. We're used to a yes it did, no it didn't way of looking at the world. So I think some of the responses that I've read were too black and white. Medical homes are no good. Well, we know that there are other demonstration projects, which we'll talk about in the broadcast, JAMA on IHI, that are very encouraging. This is not the only game in town. We also know, which was not reported in any media I read, that this was wave 1 of 7 and that there's been a learning condition. No media I read talked about the fact that there were other studies being done that would look at what characterized those practices that did better as opposed to those that didn't. In the improvement field, I think we have to be patient. Not only does it take a long time for improvement to occur, we have to remember that when a paper is published in a journal, especially in a high-profile peer-reviewed journal, that may not be the whole story. Almost always these days there are other papers that appear in other journals, maybe not the very top-tier journal, that explicate what really happened. And we need to learn how to investigate that so that we don't rush to judgment and say, oh, well, they didn't improve because they didn't do X, Y, Z, and alpha, beta.